Have you ever thought about something that seems, pretty simple on the surface, like accessing essential services?
Yeah, things we might take for granted.
Exactly. Take getting dental care if you rely on a guide dog. It sounds straightforward, right? But when you actually look into it, it's a whole maze of rules, rights, and practical stuff.
It really is. There's more to it than meets the eye.
So today, that's what we're tackling. We're doing a deep dive into the actual guidelines, the real rights surrounding guide dogs in Australian dental surgeries. And we're thinking particularly about someone like you, maybe you're in Clyde, North Victoria, and you need clear answers. Our mission, to sort of unpack the key bits from the laws, from the dental bodies, and those fantastic guide dog organizations.
Mm-hmm.
Because honestly, this isn't just about, can a dog sit in the waiting room? It's much bigger. It's about fair access to health care. That's a cornerstone, isn't it, of Australian society?
Absolutely. It's fundamental. And our goal here is simple. We want to equip you with a really clear picture of your rights, yes, but also your responsibilities. And just as importantly, what dental practices are expected to do, how they need to accommodate assistance animals. We want to clear up any confusion.
Okay, perfect. So let's build that foundation. Where do we start? The big one, I guess. The Disability Discrimination Act, 1992.
The DDA.
Yep, the DDA.
Why is this act just so absolutely central to this whole discussion?
Well, the DDA is the main federal law here. Its whole purpose is to stop discrimination against people with disabilities. Simple as that. It aims for equal opportunities in, well, pretty much all areas of public life. And that explicitly includes getting access to services like health services. Dental care fits right in there. Under the DDA, trained assistance dogs, when they're with their handlers, have the right to go into all public places.
All public places. So that covers.
Everything. Hospitals, clinics, allied health, and yes, absolutely dental surgeries. It's not like the practice gets to choose. It's a legal requirement to ensure people can access care independently. Right. Not a choice, a requirement.
Exactly. And to really get it, we need to look at Section 9 of the DDA. That's where it defines an assistance animal. It's quite specific. There are three main ways an animal qualifies. One, it might be accredited under a state or territory law specifically for disability help. Two, it could be accredited by a specific animal training organization the government recognizes. Or three, and this is the one that covers most guide dogs. The animal has to be trained to help a person with a disability, specifically to lessen the effects of that disability. And this is key. It also has to meet standards of hygiene and behavior that are appropriate for being in a public place.
Okay, so it's not just any dog. It's
Right.
about that specific training, that specific
Yeah.
purpose, and meeting those standards. I've also heard the term assistance animal is preferred over service dog legally in Australia. Is that right? Why does that matter?
That's a really good point. Yes, assistance animal is the legal term. It's broader, you see. It covers different animals trained for various disabilities, not just dogs. But the main thing for you, the listener, is that this precise legal definition, based on training and purpose, is what counts. It's what gives these animals their protected status under federal law.
So it's not just a pet.
Definitely not. And organizations like Blind Citizens Australia, Vision Australia, they constantly stress this. Letting someone with an assistance animal into the treatment room isn't up to the dentist's personal preference, it's mandatory. Federal and state law says so.
So let's make it practical. For our listener, maybe they have a guide dog, they go to the dentist, and someone says, no dogs allowed. What does the DDA mean for them right then and there?
It means that refusal is unlawful. Plain and simple. Discriminating against you because you use a seen eye dog or guide dog in any public place, including a dental clinic, is against the DDA. And it's not a small thing. Non-compliance can lead to formal discrimination charges.
Wow. Even if there are slightly different local rules, you mentioned Victoria might be a bit different.
Yeah, there can be nuances. Guide Dogs Australia points out that Victoria's Specific Domestic Animals Act might not have a general offense for refusal like some other states, but, and this is crucial, the federal DDA overrides that. It applies everywhere in Australia. So even if a local council rule or a specific state act is silent or different, the DDA's protection stands. That refusal is still unlawful discrimination.
So the bottom line is you have a really strong, legally protected right to access that dental service with your guide dog.
Absolutely. That federal law provides powerful backing.
Okay, we've got the DDA firmly established as the legal base. Now, let's zoom in on the dental world itself. What does the main professional body, the Australian Dental Association, the ADA, say? Do their guidelines line up with the DDA?
They do, very clearly. The ADA has specific guidelines, like one called Dogs and Dentistry, Appropriate Management in a Practice Environment. It's quite direct. They explicitly state that assistance dogs are permitted inside dental practices. And importantly, that includes the clinical areas, where the actual treatment happens, provided the dog is with the patient.
Even in the treatment room itself.
Yes, and they directly reference the DDA and its definition of an assistance animal. So they're aligning with the law, but also giving their members practical guidance on how to manage it, balancing access with infection control.
That makes sense. So they're not just saying all dogs are fine, are they?
No, definitely not. That's a really important point. The ADA makes clear distinctions. They have a sort of classification. Top tier, the assistance dog, as defined by the DDA. This dog has a legal right of access, full stop. The main thing here is making sure it meets those DDA hygiene and behavior standards. Then you have therapy dogs. Now, these might be beneficial, perhaps for anxious patients, but they have no legal right to be there. It's totally up to the practice.
Ah, okay, discretionary.
Entirely. And usually they need special training, certification, and very careful infection control planning if a practice chooses to allow them. And finally, private pets. Just someone's companion animal. These have no legal right of access, and the ADA rightly points out the potential hygiene and safety risks.
So a very clear hierarchy. It's not a free-for-all, but a specific, legally protected path for assistance animals based on their training and role. That clarity must be helpful for everyone involved.
Definitely. It avoids confusion.
Now, thinking about our listener again, perhaps in Clyde North, Victoria, I know the federal DDA applies, but does Victoria itself add anything? Are there state laws that give extra backup?
Yes, there are. Victoria has its own laws that reinforce this. The main one is the Equal Opportunity Act 2010. This act prohibits discrimination based on disability across many areas, including getting goods and services like dental care. And the Victorian Equal Opportunity and Human Rights Commission is very clear. Discriminating against someone because they use an assistance dog is against this state law.
So another layer of legal protection.
Exactly. And what's really interesting about the Victorian Act is this concept of a positive duty.
Positive duty, what does that mean?
It means service providers, like dental clinics, can't just sit back and not discriminate. They actually have a proactive duty, an obligation to take reasonable steps to eliminate discrimination and barriers for people with disabilities.
Wow, so they have to actively think about making things accessible.
Yes, it's about being proactive, not just reactive. Plus, Victoria also has the Disability Act 2006, which focuses on improving services and set up the Disability Services Commissioner, offering another place to go if issues arise.
Okay, so even if that specific Domestic Animals Act doesn't have the general offense clause, the combination of the federal DDA and these Victorian laws, especially the Equal Opportunity Act with its positive duty, creates a really strong safety net.
It absolutely does. It means you should feel very confident expecting accommodation in Victoria.
And you mentioned building codes briefly.
Yeah, just briefly. Things like the Building Code of Australia and the Disability Access Standards for buildings. They mainly deal with physical things, ramps, door widths, that sort of stuff. But by making the building itself physically accessible for mobility aids, they indirectly help make it easier for someone navigating with a guide dog, too. It all contributes to overall accessibility.
It really paints a picture of multiple layers of support, legally speaking.
Precisely. A strong foundation.
Okay, so we have the law, we have the Dental Association stance.
Yeah.
Let's talk about the organizations on the ground, the ones working directly with guide dog handlers day in, day out. Guide Dogs Australia, Vision Australia. What's their role in all this?
Oh, their role is absolutely crucial. They are the advocates, the educators, the support system. They consistently hammer home the message. Guide dogs, seeing eye dogs, dog guides, whatever term is used, are legally allowed in medical facilities, including dental surgeries. Denying entry isn't just poor service, it's unlawful discrimination.
Oh, so they're really pushing that awareness.
Yeah. Constantly. They even develop things like special access rights cards, sometimes working with the police, just to educate businesses about their legal duties. Because often refusal comes from misunderstanding, not malice. And they also do a huge amount of work explaining the intense training these dogs go through.
Like the public access test.
Exactly, the PAT. Many assistance dogs have to pass this test to prove they can behave properly in public. It shows they meet those high hygiene and behavior standards the DDA talks about. It really underscores that these are highly skilled working animals, not just pets wandering in off the street.
That training is key. But we know, sadly, access sometimes is still denied. What do these organizations do then? You mentioned an Access All Areas campaign.
Yes, unfortunately, denials still happen far too often. Guide Dogs Australia did surveys showing just how frequently handlers face this, which is what sparked campaigns like Access All Areas. The aim is just constant reinforcement to businesses and the public about the law. Vision Australia also gives very clear advice. If you're refused entry, first, try to calmly inform the person or business about your rights.
And if that doesn't work,
Then report it. Report the discrimination to the police or to Vision Australia's own advocacy team. They need to know where these issues are happening. Another vital part of their work is public education on guide dog etiquette. This is so important for everyone to understand.
right. What's the key message there?
The absolute key is when the dog is wearing its harness, it is working, period. That means you should not distract it. No talking to it, no making eye contact, definitely no patting, and absolutely don't offer it food unless the handler specifically says it's okay.
Why is that so critical?
Because any distraction, even a small one, can break the dog's concentration. And that concentration is vital for the handler's safety and navigation. The dog needs to focus on its job.
That's such an important point. The harness means hands-off, mind-focused. It really drives home that this is a professional partnership.
Exactly. Respecting that boundary is crucial.
It's a powerful reminder for all of us listening. You see that harness, you know that dog is performing a vital role for its human partner. Okay, let's tackle the elephant in the room, especially for a place like a dental surgery. Hygiene and safety. What do the sources actually say about the real risks versus the perceived risks?
It's a completely understandable concern for any healthcare setting. Hygiene is paramount. But interestingly, the DDA itself builds in a safeguard. Remember how it defines an assistance animal? Part of that definition is that the animal must meet standards of hygiene and behavior appropriate for an animal in a public place.
Ah, so the law itself anticipates this.
Precisely. It sets an expectation. Guide dogs are trained and expected to be clean and well-behaved before they even enter. And think about it. The Australian Dental Association, which is obviously very focused on infection control, still explicitly accepts the legal right of access for these dogs, even into clinical areas.
So they believe it can be managed safely.
That seems to be the implication, yes. That a properly trained and maintained guide dog doesn't automatically create an unmanageable risk if sensible procedures are followed. In fact, some sources, like the ones referencing CDC guidelines, go further. They suggest that assistance animals might not actually pose a greater infection risk than people do, as long as standard cleaning happens.
That's interesting, compared to humans.
Yes. The CDC point mentioned was basically, if humans, staff, patients, visitors can go into an area without needing extra precautions beyond standard ones, then a service animal generally should be allowed to. It helps frame the risk level.
Okay, so if it's manageable, what does that look like in practice? During a dental procedure, what actually happens with the dog?
It's usually about pretty simple, practical steps. The main thing is ensuring the dog stays on the floor. It shouldn't be on furniture or near sterile equipment.
Just finds a spot on the floor?
Usually, yes. Lying quietly near the handler. Open communication is key here. The dentist and the handler should just quickly discuss the best place for the dog to settle, making sure it's out of the way, but still close enough for the handler's comfort.
Are there any situations where a practice could legally refuse entry based on hygiene or safety?
Very rarely. The denial has to be based on a demonstrable, unmanageable risk posed by that specific animal at that specific time. For instance, if the dog was clearly unwell, vomiting, or acting aggressively and couldn't be controlled. But it can't be a blanket no dogs ever policy based on a potential risk. It has to be about the actual state or behavior of that animal right then.
So it's about managing actual observable risks with reasonable steps, not just banning based on fear or assumption. That seems fair.
Exactly. Targeted measures, not discriminatory bans.
So, pulling all this together, how can we ensure things go smoothly? What are the best practical tips both for you, the listener with a guide dog, and for the dental practices themselves?
Okay, for individuals with guide dogs, a few things can really help. Firstly, letting the practice know beforehand that you'll be bringing your guide dog is a good idea.
Just a heads up.
Yeah, just gives them time to prepare, make sure staff are aware. It can just smooth the arrival. Also, while technically you don't have to show ID for the dog under the DDA, having it handy can sometimes speed things up and answer questions before they're asked. It's not legally required, but can be practically helpful.
Makes sense. What else?
Ensuring your dog is clean and well-groomed before the visit is important. That addresses the hygiene aspect proactively. And being ready to discuss where the dog will sit or lie during treatment. The dog will usually just settle quietly on the floor near you.
Okay. And what about the dental practice? What should they be doing?
Top of the list. Staff training.
Mm.
Make sure everyone, from reception to the clinical team, understands the legal rights, the definitions, and basic etiquette around assistance animals. So much friction comes from lack of knowledge.
Training is key.
Absolutely. Also, keeping pathways clear is simple but important for someone navigating with a dog. And while the dog usually stays with the handler, maybe offering a quiet corner if the handler prefers could be a nice gesture, though not required.
And communication again.
Always
Open.
open, respectful communication, asking the patient what they need, explaining procedures clearly, discussing where the dog will be. It's all about creating that comfortable, respectful environment.
It really boils down to preparation on both sides and just
Yeah,
talking to each other, fostering that sense of mutual respect.
that's exactly.
That really does tie it all together nicely. Preparation, communication, respect. It feels like a recurring theme in these deep dives, doesn't it?
It often is, yes.
So let's wrap this up. What's the big picture here? We've journeyed through the Disability Discrimination Act, looked at Victoria's Equal Opportunity Act, seen the ADA's clear guidelines, and recognized the vital role of organizations like Guide Dogs Australia. The right to access dental care with a guide dog seems really firmly established.
It absolutely is. The legal framework is strong. The professional guidance is there.
It really shows how our understanding of accessibility is moving forward. It's not just about ticking boxes anymore. It's about genuine inclusion.
That's right. And ensuring that access works in practice needs two things. Everyone understanding the laws and guidelines, yes, but also a real commitment from dentists and their teams to create environments that are genuinely welcoming and inclusive.
Knowledge plus commitment.
Exactly. And this whole conversation prompts a further thought, perhaps for you, the listener, to ponder.
Hmm.
How might our general understanding of things like hygiene and safety in shared public spaces need to keep evolving? Especially as we become more aware of diverse needs
Hmm.
and the absolutely essential professional role that assistance animals play in so many people's lives.
Hmm. That's a great question. How do our definitions adapt as society becomes more inclusive? Food for thought indeed. Well, we really hope this deep dive has given you that clarity and confidence we talked about at the start, clarity about your rights and responsibilities regarding guide dogs in dental surgeries.
We hope it's been helpful.
Thanks so much for joining us for this really insightful exploration.